So let's begin with our first section, in which we will talk about the different bacterial infections that can cause granuloma formation in the nose. And the diseases which we will talk in detail in this section will be tuberculosis, lupus, vulgaris, and also leprosy. And besides these diseases, we will also discuss the overview of granulomatous diseases. So first, the overview. Cause of granulomatous diseases of the nose can be bacterial causes, it can be fungal causes, and also some unclear cause of granulomas of the nose. The granulomatous disease of nose, the bacterial causes can lead to rhinoscleroma, syphilis, tuberculosis, lupus, and leprosy. All these are the bacterial causes that can lead to granulomatous disease of the nose. Then the fungal causes will be that can cause rhinosporidiosis, aspergillosis, mucormycosis, candidiasis, histoplasmosis, and blastomycosis. Mycosis are the fungal infections. So whenever you see histoplasmosis, blastomycosis, all these are fungal infections. So granulomatous diseases can be fungal, bacterial, and also some unspecified or unclear causes, which include Wegener's granulomatosis and non-healing midline granuloma, and sometimes rarely sarcoidosis. So these are the causes of different granulomatous diseases of the nose. First, the tuberculosis, which is bacterial infection. So tuberculosis is caused by tuberculin bacillus, Mycobacterium tuberculin. So tuberculous bacillus are rod-shaped organisms. So these, if you see, these are rod-shaped, not the round-shaped, which are cocci. Cocci are round-shaped, bacilli are rod shape. So tuberculin bacillus is the causative organism of tuberculosis. Primary tuberculosis of nose is rare. Secondary to lung tuberculosis. So primary is rare. So tuberculosis of nose is rare, but usually the tuberculosis of lungs, it can spread and cause tuberculosis of the nose. Sites which are involved is anterior part of nasal septum. Nasal septum is the portion that divides the nose into right and left side. So anterior part of the nasal septum is involved, and then anterior end of inferior turbinate is affected by nasal tuberculosis. Nodular infiltration, there it can lead to ulceration, and then finally ulceration can cause perforation of nasal septum in cartilaginous part. So first the nodules are formed, then the nodules in ulceration occurs, and then the ulceration causes thinning of the area, and this can cause perforation or hole in the cartilaginous part. Diagnosis is by biopsy, staining for acid-fast bacilli, and culture of the organism. So diagnosis usually done by the biopsy and by the acid-fast staining and culture, which can grow the Mycobacterium tuberculosis, and usually it's done by the culture of the sputum, and then the growth of the bacteria occurs. Treatment is anti-tubercular drugs. Next is lupus vulgaris. This is the picture of the lupus vulgaris, low-grade tuberculous infection commonly affecting nasal vestibule or skin of nose and face. So lupus vulgaris is low-grade tuberculous infection, and it affects the nasal vestibule and also skin of nose and face. Nodules are called apple jelly nodules. They are gelatinous, and apple jelly nodule, if you ever saw the apple jelly, it's gelatinous, thick material, and its nodules are like that. Formation of perforations occur, as I mentioned in the previous slide also. There is nodular infiltration leading to ulceration and then perforation. In this case also there are gelatinous nodule and then there is perforation. Diagnosis is biopsy only. Isolation of tubercle bacilli is difficult. So in this case, culture to isolate the bacillus is difficult. So diagnosis is on the biopsy. Treatment is same as for tuberculosis, which is anti-tuberculin drugs. Then the leprosy. This is the diagrammatic appearance, common in tropics and prevalent in India. So leprosy is common in India. The causative organism is Mycobacterium lepra. Like Mycobacterium tuberculosis, this is Mycobacterium lepra. Nose is involved more often in lepromatous than in tuberculoid or dimorphous form. So lepromatous form more commonly involve the nose. Starts in anterior part of nasal septum or inferior turbinate. So anterior part of nasal septum or inferior turbinate usually is affected first. Then excessive nasal discharge with red mucosa. Crusting and bleeding occurs after that. Then we have nodular lesion on the septum that may ulcerate. If there is perforations occur, atrophic rhinitis, depression of bridge of the nose because of atrophy. Destruction of anterior nasal spine occur, and there is a retrusion of columella occurs. So diagnosis and treatment is there is scrapings of nasal mucosa and biopsy. Acid-fast lepra bacilli observed in lepra cells. Here, if you see, there is depression of the nasal bridge because of atrophy, and a picture of how it can affect or damage the nasal area. Treatment is dapsone, rifampin, isoniazid. These are the drugs used for tuberculosis also. And then reconstruction procedure, if there is any deformity, then reconstruction should be done. So that was all about section 1, in which we talk some bacterial causes of granulomatous diseases of the nose. Thank you for watching sqadia.com.